Hello, today I'm going to show you the 3Mensio workup of a TAVR procedure with alternative access using the right carotid approach. The left carotid approach is going to be similar in terms of workup, so I'm going to go in the interest of time show you just the right because it's probably more common access approach. So you can see this is the main layout, and I'm going to go to the subclavian tab. And then from there, I'm going to segment the carotid artery. So I'm going to crop this so I can see the aortic arch clearly. On the LAO view, I'm going to try to segment all the different arch vessels. You can see that the left carotid is here. In fact, this patient has a aberrant left vertebral artery, so I'm going to try to segment that as well just to show you. So every time you add a vessel, you go highlight and then click on that. So add vessel. So what you want to avoid is to try to segment other structures that are not important or that might show you the artifact. So such as the venous side that has contrast. So once you're done, you click OK, and then you can see that here, a very nice segmentation of the carotid arteries here. So I'm going to go from the aortic root. So what you can do is you can start from the aortic, even the LVOT if you want. And then all the way up to the carotid artery. Sometimes you might want to extend it. We typically, if we want to do a carotid access approach, we may actually go even higher into scanning the bottom part of the neck. So you can actually visualize the bifurcation of the common to the external and internal. But in the interest of time, we'll just do it here as is. So once you finish with that segmentation, then you go here and you see a centerline. So next step is to try to confirm the center line is indeed centered. So you might need to adjust it manually, just like you would with the TAVR access. You can see this is the takeoff denominator. There's some calcium at the ostium. So this patient actually had a femoral access TAVR, not a carotid TAVR, but I want to just show you the general workup. And you can add thoughts in between if there are any tortuosity or any kind of concern about diameter, luminal diameter. So that's kind of what it looks like. And so once you're done, you click confirm. And so here's the center line. So what you can do is you can decide where it's going to be accessing. So if this is going to be way up there, you're going to be obviously above the clavicle, probably here. You can right click and set baseline. And then you can actually measure the innominate takeoff right around here and right click and measure from baseline how long that is. So in this case, it's 82 millimeters. And then you can even go all the way down to the annulus. And you right click, measure from baseline. So it's 17.8 centimeters here. So you can see the working length here in terms of from the access point to where the insertion. You can then decide where to position your sheath to allow your delivery catheter to be advanced to the annulus. So now what we're going to do is we're going to measure the diameters of the various segmentation of the carotid and innominate artery. So here you can see, you can drop the gain a little bit. There's some calcium there. I do a ruler times 2 so I can measure the max and min diameter. This is the innominate diameter. This is the carotid diameter, common carotid diameter at takeoff. And you can see typically the carotid should be pretty clean. This is the jugular vein. So you measure all this. So you can see pretty straightforward in terms of measurements. So once you're done, you're going to put in the report. So I'm going to put in this first because I want to show the contour and the AP view. So what I'll do next is to save these images. So I start with this 3D view on an AP dimension. You can see that nicely laid out all the segmentations of the vessel size and diameter. And then you can do an RAO view if you want. It doesn't really make that much of a difference for carotid, but if the left carotid, you want to go into more LAO view, you can see the left carotid spraying out, and you can do a similar image. You can also do an angiographic view here. You can see how it looks on AP dimension. Go back to that and save that. And with the left carotid, you can, like I said, do an LAO view to visualize that. Next, I'm going to go into a centerline mode. You can go into stretch vessel. You can see that here. And I'll save that image. Right carotid. And you can also show the snake view. In the right carotid, you can go to do it this way. Want to show the left carotid, you're going to rotate a little bit more to show this segmentation. So let's look at the report. You can see that here I have a 3D reconstruction and AP view of the segmentation of the carotid artery. You can see that here in the RAO view, LAO view, especially useful for left carotid angiographic views, and then the centerline views here showing the working distances. So you can save this report and share it with your heart team. And you can also save this session as well. And here's a summary of the carotid workup for alternative access TAVR. I hope this is helpful, and we'll see you next time.